Good morning, everyone. I am Dr. Sirisha, consultant ophthalmologist at KIMS, Gachibowli. Today, I will be talking about glaucoma as part of our Glaucoma Awareness Month. Glaucoma is a disease of the eye where the optic nerve progressively gets damaged and which obviously results in damage to the vision. There are different types of glaucoma. One is angle closure glaucoma, open angle glaucoma, normal tension glaucoma, congenital glaucoma, and lastly secondary glaucoma. Today we will be discussing mainly about chronic angle closure glaucoma and open angle glaucoma. A majority of the times a lot of patients ask me, is there any way for me to know if I have glaucoma? Early stages of glaucoma, there is no way for us to know whether you have glaucoma. The best way is when you visit your ophthalmologist, we will do an IOP check. IOP is called intraocular pressure check, and a fundus check where we check your optic disc or optic nerve to see if there are any changes in glaucoma, and by doing other examinations called perimetry and OCT. The risk factors for glaucoma, it's common in adults and individuals over the age of 40. There's a high risk of glaucoma, especially if there is glaucoma in the family members. Any other secondary illnesses like diabetes, BP can also are more prone to get glaucoma. The other risk factors for glaucoma are lifestyle factors like smoking, poor diet, lack of exercise. If we suspect that you have glaucoma, for us to make a definitive diagnosis, we need to do something called visual fields or perimetry. What is visual fields? Normally, when we are looking, when we are talking, we look at what is in front of us. But in glaucoma, what happens is this area, which is called the field of vision, slowly reduces. A lot of times there is no way for us to know what your field of vision is like. So we do something called a perimetry or a visual fields test, which measures if you are able to see the periphery. Once you have been diagnosed with glaucoma, the main treatment for glaucoma is through medicines. 90 to 95% of the time you will need to use medicines lifelong. These will be drops which will be prescribed by your ophthalmologist. And what is more important than using the medicines is to continue using them, because it is not only for 1 month or 3 months, you have to use it lifetime. And the second thing is you need to have your glaucoma monitored regularly. That means your intraocular pressure, your visual fields need to be regularly checked up every 3 to 6 months for the rest of your life. So it is very important to have a follow-up with your ophthalmologist once you have been diagnosed with glaucoma. In case the pressure is not being controlled using drops, we have other surgical interventions like trabeculectomy, selective laser trabeculoplasty, laser YAG. These are all used as different modalities as and when needed, only in advanced cases. In advanced cases of glaucoma, patients develop something called a tunnel vision, where they are able to see only what is right in front of you, like looking through a tunnel. In these cases, once the optic nerve has been damaged, there is no way for us to recover the optic nerve or optic nerve function. So it is very important for a glaucoma to be diagnosed early and in time, so that the damage or the advanced damage to the optic nerve does not happen.